by Dr. Shivani, and the paper is on spot urine albumin protein is a biomolecular biomarker for severity of diabetic retinopathy. So on to you, Dr. Shivani. Can we have the slides here, please?
Good morning everyone. The title of my presentation is Spot urine albumin is a biomarker for proliferative diabetic retinopathy. Raised spot urine albumin is an indicator of a potential kidney damage in diabetic retinopathy. Spot urine test is a simple, physician-friendly, easily available and a reliable test. Spectral domain optical coherence tomography is an accurate diagnostic instrument for defining the in vivo histology of the retina, and optical coherence tomography (OCTA) is an extension of the OCT which offers an imaging of the retinal vasculature. The aim of the study was to evaluate spot urine albumin levels as a biomarker for proliferative diabetic retinopathy and to correlate the stages of diabetic retinopathy with various OCT parameters depicting a neurovascular unit. Data collection was done, and this design is a tertiary care center based cross-sectional study. A total 104 sample was taken, total 78 cases and 26 controls. Spot urine albumin was measured, and SDOCT parameters like foveal avascular zone, superficial vessel density, deep vessel density, and OCT RNFL and OCT ganglion cell analysis were also examined. The sample size were divided into controls, no diabetic retinopathy, non-proliferative diabetic retinopathy and proliferative diabetic retinopathy. As we can see in this box and whiskers plot, the association of spot urine albumin and the stages of diabetic retinopathy, and we can see with the increasing pathology, there is a steep increase in the spot urine albumin levels. We can also see these OCTA parameters, where we can see that the foveal avascular zone is increasing, whereas the vessel density is decreasing with the increasing severity of the disease. In this, we can see that the thickness of the OCT RNFL is also decreasing, and ganglion cell analysis thickness is also decreasing with the severity of the disease. In the receiver operator curve analysis, we can see that the PDR is having an area under curve of 1, which is an excellent, so we can say that this is an excellent biomarker for predicting the proliferative diabetic retinopathy. So conclusion is, spot urine albumin is a novel biomarker for proliferative diabetic retinopathy. It predicts the progression from NPDR to PDR, and it correlates significantly with the superficial vessel density, deep vessel density, foveal avascular zone, RNFL and ganglion cell analysis on the OCT. Thank you.
Thank you, Dr. Shivani. So how frequently do you call the patients for follow-up?
Ma'am, it was a cross-sectional study. So first of all, when the patients came to us, they were like seen if they are if they are fitting our inclusion-exclusion criteria. After that, we was taking the patient's measurements. First, if they were classified into their specific groups and they were examined, all the data was stored and analyzed retrospectively. They were not coming to us in follow-ups. It was a one-time study.
Okay, so for the future take-home message for all of us, how do you think we should monitor these patients? What do you get from your study?
The main purpose of my study was, as we all know, that India is the diabetic capital of the world, and the OCT machines and all these machines and the retina surgeons and specialists are not available everywhere. So in PSCs and CSCs, this is a very physician-friendly, economical and simple test to do. It can be done by anybody. We can train people for that, and we can see that if this patient is having diabetes and if this patient is having this much of spot urine albumin measurement, then in which grade this patient might come. So it will be easy for us to screen those patients and refer them to the centers where they can be given proper care.
Okay, that's excellent. Thank you, Dr. Shivani.